partners who support our AIRS project, and I just want to take a few minutes to highlight just a few of our key partners. First, I'd like to acknowledge the Minister of Health for Liberia. And today we are honored to have the Minister of Health herself here, the Honorable Dr. Wilhelmina Jola, who is here today to speak. So I would like to thank Dr. Jola for being here with us. Dr. Jola is only the second Minister of Health to attend a climate summit, so we're very honored that she was able to make it today. I'd also like to recognize ECOWAS, which is the Economic Community of West Africa States, Johns Hopkins University, and of the Lancet Global Oxygen Commission. Now, our first presenter I'd like to bring up is Mr. Abdul Latif from the African Diaspora Forum.
Thank you. My name is Abdul Latif Balanta. I am the Executive Director at the Diaspora Africa Forum. I'm also a Pennsylvania attorney in the United States. The Diaspora Africa Forum has the unique distinction of being the only diaspora organization which has received full diplomatic accreditation by a country, and that country is Ghana. Ghana has given all of the diplomatic privileges because we represent the diaspora as if we were representing a country. That includes a diplomatic passport for the ambassador, as well as diplomatic immunities and waivers from taxes and other liabilities. The Diaspora Africa Forum has been involved in this project as well as in other projects by actually helping to mobilize the diaspora to both give back or to look back to the continent. This is our mission. We actually report to the African Union, and our primary aim is to support their aims and objectives. But every so often we get an opportunity like this to work with a group of organizations or members who are doing good things on the continent. And in that respect, what we do is we say, make sure you use diaspora doctors, make sure you use diaspora suppliers. In this case, you're going to hear about a program where they're actually installing oxygen in hospitals and then powering that oxygen with solar panels. Both the piping company that is piping the gases, the oxygen to the hospital beds, as well as the solar company itself is a diaspora company. What we do when we go to a country, we don't impose our will upon them and say, this is what we have, take it or leave it, but rather we seek their advice and their counsel in terms of what they're looking for. And the three countries that we've gone through, that we're working on right now, is Liberia, Sierra Leone, and the Gambia. And in each one of the countries, they had a different approach. One of the countries said, please provide oxygen to our largest hospital. Another one of the countries said, please provide it to one of the middle-sized, more teaching hospitals, mid-size. And then yet another country said, please, there's a rural hospital that's far out, it's not even on the grid, and they need solar panels as well as the oxygen that you speak of. So when we bring a project to some country, we make sure that it has a diaspora component to it, but rather that it speaks to the needs of the local country. In this case, we have a case study that you'll see which speaks particularly to the Liberian situation. And everywhere, even if we have a progressive and a minister with foresight, as in this case, in those cases, we try not to impose any burdens on the government. Our business model is to provide what we call direct investment in public health, which means that we don't involve the government we don't burden the government with the burden of administering the project, but rather with their blessings, we provide the resources and the solar panels and the oxygen direct to the hospital, direct to the people who need it. So we thank you, and we hope that you'll enjoy this presentation. You'll get an opportunity to make some of the decisions that went into our decision-making process as we decided how we were going to help these countries. Thank you.
Thank you so much. Now I'd like to bring up Dr. Redit Smells Worknut. Dr. Smells Worknut is an Ethiopian anesthesiologist and is an SCCM African member. She's also one of 20 people in the world chosen by the Lancet Global Health and is an oxygen commissioner. Dr. Lancet.
Thank you. Thank you all for attending this interesting event. Oxygen. Yeah. Oxygen is a breath of life. Medical oxygen is one of the essential medicines listed by the World Health Organization as one of the essential ones, and it's irreplaceable. Every hospital needs to have oxygen available to treat all sorts of patients that include newborns, pregnant women, elderly patients, patients who have chronic conditions, patients who have asthmatic attacks, patients who have sustained trauma and need to have surgery, for routine care of anesthesia, for any routine surgery that the patients need, for cancer patients, and even recently, our COVID-19 patients. Without oxygen, those patients could not have been treated. Better access to oxygen could have prevented that devastating death toll of 20 million. That is, these patients, if they were availed oxygen to, much of these deaths could have been prevented. In a study done in 64 intensive care units in Africa, this was a study done in 10 countries, they showed that 1 in 2 patients died being denied of oxygen. That is 50% of the patients that needed oxygen didn't get it. Can you imagine yourself being in that situation? These are not just critical care patients. These are patients who are lying, who were waiting at the emergency room to get oxygen. These are asthmatic patients. These are children with pneumonia. These are treatable conditions with just oxygen, and they were denied care. These were patients who are oxygen access denied. And COVID-19 pandemic, I would say thank you to it. It has shown us that there was a huge gap that needed to be filled when it comes to oxygen therapy. And many hospitals they have realized the need to avail oxygen, so they're planting oxygen plants, and much investment is going there too. As our Lancet Commission says, access to oxygen is a measure of health equity, and access to oxygen should never be denied, as oxygen is a breath of life. Thank you.
Thank you so much. Now I'd like to bring up Dr. John Sampson from Johns Hopkins University.
Good afternoon. So today is going to be a wonderful interactive day. We're going to interact with you. Everyone should have a clicker. And we're going to be talking about oxygen decision making. But I want to give you just a little bit of background information on oxygen generators. We're not really going to talk in this session about what's called cryogenic oxygen. Cryogenic oxygen is liquid oxygen. And honestly, most of the locations that we've looked at, most of the countries we looked at in Africa, cannot afford this particular one unless they have some really deep pockets for funding. We're going to be talking about the type of oxygen generation that is more commonly done at healthcare facilities in the continent, which is either pressure swing absorption or vacuum swing absorption, either PSA or VSA. So those are the technologies that, although expensive, are more affordable and more likely to be something that you can access. So we're not going to go into the details of the technical aspects of that, but just talking about those particular types of oxygen generation for your interactive workshop. So make sure everyone has your clicker.
Thank you, Dr. Sampson. Now I'd like to bring up Dr. Serena Cruz, who will take us through the workshop. Dr. Cruz.
So just some housekeeping. Raise your hand if you need a clicker. Okay, this person here needs a clicker. This person here needs a clicker. The person in the back needs a clicker. All right, keep those hands up. It's clicky time. Okay, so we're gonna do a case scenario. Everyone in this room is a government stakeholder. We need a clicky here. And your role is to make policy decisions that directly affect the life of your patients in your country. So, you're going to be given 5 oxygen plants in a particular region, okay? The scenario is that there's going to be biomedical training available, and the plants are going to need to be maintained after they're created, okay? Are you ready, government officials? Okay. So the idea behind this is that you have to make these decisions in certain contexts: urban, peri-urban, or rural, okay? All right. Question number 1, government stakeholders. Based on these beautiful pictures, you're going to have to choose what type of oxygen generation plant this is. They're all oxygen generation plants. They all have a common technology. They're all being deployed in the 3 types of contexts I told you: urban, peri-urban, and rural. So, when you're ready, are we ready, Jeff? Please pick your oxygen generation plant. With your clicker. We can't possibly only have 6 voters. There's no wrong answers here. 8, 9, 11. Keep going. Come on, voters. Your leaders here. 13. Raise your hand if you have not managed to do the clicky. 14. All right, I'm going to cut it at 15. Let's go. Come on, number 15. All right, what do we got? Okay, the majority here of our leaders have decided option number 4. What does that mean, Mark? Who's next?
I don't know. You tell me. So I'd like to bring up Okonkwo Mubagwa, who is CEO of Winco Solar, who will explain the consequences of the various choices you just made.
So let's have a look at the consequences of your choice in terms of energy consumption. Choice number 2 seems to lead to way less consumption than all of the other alternatives, which in consequence, Jeff, means less consumption of fuel, which has a direct impact on your cost of fuel per month and per year. If we look at the difference between the extremes, choice number 2 is $15,000 less per year than choice number 4. We looked at consumption. Let's look at emission. Once again, choice number 2 seems to lead to significantly less emissions of carbon dioxide than all of the other choices. That has a direct impact on the yearly amount of carbon credits that you need to buy in order to offset your emissions. Comparing the extremes, that leads to a surplus of over $3,000. So what is it? What is it about technology or choice number 2 that makes it that it consumes way less fuel and hence costs less in terms of fuel and emits way less carbon dioxide than all of the others?
So now I'd like to bring up Tim Bolton, CEO of PCI Gases, to explain. Oh, I gave you a promotion.
I'd love to be. I'm just the sales and marketing director for Europe, Middle East, Africa. So if the CEO heard this, he'd fire me. Just a brief recap. The oxygen that we all breathe is 21% or 20.9%. So of the oxygen we breathe, about 79% is not necessary for us to live, so we breathe it out again. So if we then go to the next slide, there are differing technologies. These are on-type technologies, so the basic principle is the same. You have a tank full of what we call zeolite. This is a filter. It's for filtering the ambient air. You pressure air through the filter, and you get out your medicinal oxygen. So the systems, the common systems known are PSA, pressure, swing, absorption, and vacuum swim absorption. Both the processes get out they filter out the impurities. We call them impurities. So a major part is nitrogen, the other gases, but also CO, CO2, hydrocarbons. It's a completely regenerative process, i.e. you take some of the oxygen that you've produced and you blow it back down through the sieve and you clean it, and then the process then restarts. The difference between the two systems, and this is why we're talking about power consumption, is the difference between the two systems is the PSA is a single stage, which means you take the total volume of ambient air, which includes the 78% nitrogen, you pressure it through, and you make your oxygen. But then you have nitrogen in there. So then you have to exhaust the 78% nitrogen. So you're throwing away something that you've just pressured up, which is not power efficient. The VSA system does it in 2 stages. So you make your oxygen first at a very, very low pressure, and then you take your oxygen and you pressure it up to the pressure that you need in your pipeline system. So there you can see, instead of pressuring the total volume, although you only need 1/5 of that volume, you are taking only the oxygen and you're pressuring that. So I'd like to show you now a short video where you can see these systems in operation. On the right-hand side there, you can see one of these systems. That's a 500 liter per minute system, which is enough for about a 500 to 700 bed hospital. And these are the oxygen generators. This is the process of a VSA, which is very, very simplified, as you can see, with just the inlet blower and the power consumptions you can see here compared. This is the actual system, so you can see the size here. This is the intake blower, which only works at less than 1 bar pressure, which is very, very good because you don't need to dry the air beforehand. All these systems make oxygen 93. You can see here the concentration is measured, also the pressures. Another picture of this type of system, and this is the connection between the blower and the electric motor which is driving the blower. The system is pressure driven, so that we censor the pressure in various parts of the system to keep it in operation. So here you have now the comparison of the two. As you can see on the left, there's the PSA system, quite complex with a lot of valves. You need a dryer to dry the air before it goes into the system. And you also have this is the comparison. That was rather quick. We were comparing also the valves that were there and the moving parts that were there. These are just 3 examples of systems installed. China, Toronto, Canada. There are 4 systems there, and also Brazil you can see at the bottom. Thank you very much.
But what about our surplus? What about the $15,000 that we didn't spend on fuel by choosing number 2? And what about the $3,000 that we didn't spend on carbon credits? That's a total of over $18,000 that we can allocate within the healthcare facility. What do we do with these diesel dollars?
So to explain how we can spend that money, I'm going to ask Dr. Linda Bafi, who's representing the Ghana Health Services and also EcoWise, who's also today speaking on behalf of EcoWise RCC Chairman Dr. DaCosta Abuja, who isn't able to attend today. But she'll explain how we can use those diesel to dollars that we just captured.
Thank you, Mark. Thank you, everyone, for coming. So you would all agree with me that the healthcare system in Africa needs every single dollar it can save from diesel, because we all know the many challenges that we are experiencing in the midst of very scarce resources. These diesel dollars can be used to support preventive health, obstetric care, surgical care, among others. When we look here, we have a picture of a woman undergoing pap smear, which is a procedure that is used to detect abnormal cells in the cervix before they become cancerous. Using these diesel dollars to support such preventive health programs has the potential to save a lot of women in Africa. Currently in our continent, cervical cancer ranks either first or second among all female cancers, But globally and in high-income countries, the cancer doesn't rank that high. Why? Because of support for preventive practices in high-income countries. So let us adopt the vacuum oxygen technology, save some diesel dollars, invest in preventive health, and save our women. Obstetric care. We have a picture of a beautiful pregnant woman here. Pregnancy and delivery, we all know, are natural processes. That's supposed to be a happy one. But our maternal mortality is alarmingly high. Currently in Africa, we are losing as many as 430 women for every 100,000 live births, compared to 12 per 100,000 live births in high-income countries. And most of the causes of these deaths are preventable, such as low blood level or due to infections. So why don't we save some diesel dollars from adopting this oxygen technology and use it to address these critical healthcare challenges to save our women? Access to surgical care is limited in all areas of Africa. When you come to urban areas of Africa, rural areas of Africa, there is limited access to surgical care due to a lot of factors, commonly due to either ill-equipped operating rooms, shortage of medications, shortages of surgical equipment. Saving diesel dollars can be used to address this scarcity, to make access to surgical care easy for Africans. The importance of hospital infrastructure development, I cannot overemphasize it enough. We all experienced COVID-19, and we are here because we survived COVID-19. The early part of this year, we all heard of the massive earthquake that happened in Turkey. During disasters, hospitals are usually the first point of call. That is why in Africa, the largest growing continent, we need to invest sufficiently in our hospital infrastructure to take care of the health needs of our growing population and also respond adequately to future health emergencies and pandemics. Why don't we adopt the vacuum oxygen technology, save on the money that we would use to purchase diesel fuel, to invest in hospital infrastructure? Lastly, I want us to know, as participants of this summit, let us seize the opportunity that this vacuum technology has offered to us. Let us save diesel dollars in order to save lives, especially of our women and children, both now in Africa and in the future. Thank you.
I don't really know what to say. Linda, that was really intense and beautiful. I'm getting caught up in wires. So what have we learned so far? We've learned that there's a technology that allows us to move away from diesel dollar waste and invest in healthcare dollars and infrastructure. By doing that, we're going to cut down on a couple things. We're going to cut down on the production of carbon dioxide, and we're going to lower greenhouse emissions. Okay, and that's the real climate impact. Next slide. Okay, with that background, we're going to talk about best practice one. What we've learned is, as government officials, don't worry, this workshop's not over. You're going to click again. You now know you have to plan for energy efficiency. So the theme is convert your diesel dollars to healthcare dollars. Okay, what's next? Decision two. All right, so everybody, you two walked in later, so we need some cookies here. Okay, so decision two, and just a recap for our late blossoms, we want you to know that you're government officials and you need to make informed policy decisions. Our previous government officials, are you ready to make another decision that's going to impact the lives of your patients? Are you ready? Are you sure? You sound tired. Okay, this is the quiet people. All right, so question for decision two. How will you power your oxygen plant? Are you going to power it with a grid? Are you going to use some diesel generators, folks? Or is it possible to transition in a context that's urban, peri-urban, or rural to renewable sources? Are you ready? Are your clickers at hand? All right, start. Six, really? Come on. Let's try for 15 again. 15, 1-5. Come on, folks. We're only at 8. Let's go. What's it going to be? Power grid, diesel, renewable. Can we get it to 10? Oh, sorry. Is that me? Oh, that's you. Okay. All right. Who hasn't clicked? Raise your hand. Who has clicked? Raise your hand. Okay. Is that 8 hands? All right. Let's see what we've got from the 8 that clicked. I'm so glad that you picked that after this first part. All right. What do we got next?
Let's look at the consequences of your choices. If you chose number 1, grid-powered energy, well, you don't have to consume any fuel, it's true, but you have the yearly cost of your electricity bill, which is $7,000. You do not emit any carbon dioxide. If you chose choice number 2, to use fuel power generators, that means you need to pay for your fuel consumption every year, upwards of $20,000. And on top of that, your fuel consumption generates over 50,000 tons of carbon dioxide every year. However, if you chose for renewable energy, you don't have to pay for fuel, and you do not emit any carbon dioxide. So it seems obvious that choice number 3 is better in terms of dollars for diesel and environmental impact. There's a desperate need for energy in Africa, the fastest growing population in the world. If you look at all the countries in red, they have less than 20% of their population has access to energy. This impacts their lives daily in terms of sense of isolation, in terms of productivity, in terms of safety, and in terms of healthcare, where people are dying, every day dying. So there is urgency. Solar energy is the only energy technology that is leverageable at any scale. It is decentralized, so it can be deployed rapidly than any other alternative. It is the energy solution for our continent for the next century. And most importantly, it is sustainable. Sustainability also has financial implications. The Kyoto Protocol operationalizes the United Nations framework in terms of countries committing by regulation to limit their greenhouse gas emissions to a certain target. Countries can buy carbon credits in order to reach that target from other countries that generate carbon credits by going beyond the target that is stipulated by regulation. And thus, there is a market for carbon credits. There are then real financial implications and a real economy behind sustainability.
Okay. Best practice, too, that we've learned is in planning the efficiency and seeking to convert diesel dollars to healthcare dollars, we want a renewable energy source in combination with the vacuum swing absorption, right? Because it's less energy wasteful. All right, so after this best practice, I think we have another, Mark, do we have another decision to make?
Yes.
All right, this is our last decision, so get those clickers warm. All right, you're gonna answer this question. Now that you know that there's a VSA technology, and now that you know that there's solar, we want you to consider how you're going to design your oxygen plant, okay? So scenario number 1 is you have a centralized oxygen plant, but then you're going to truck in tanks. You're gonna bring tanks to the facility, okay? In cylinders that are quite heavy. or you're going to invest in a plant that's on site. So by doing that, you're going to make a decision about design. Are you ready? Are we ready? Please vote for 1 or 2. It's coming. We're at 8, okay. Are we gonna get to 10? We've got somebody nodding. She's like, yes, we're gonna get there. We're at 9, come on, let's get to 10. Come on, leaders, this is your chance to demonstrate how much you care. Are we stopping at 9? What do you think? Should we, no, you want us to keep going? All right. Well, we've decided to do hospital-based oxygen pipes. What does that mean?
Well, let's tell them. So I'd like to now bring up Stephen Domingo, who is head of partnerships at Winco Solar.
How are you guys doing? So now that we have seen what you guys chose, I think we'll expand a little bit about the cost of diesel and the impact on climate change with regard to emissions. So I'd like to direct you to 3 relationships between the different oxygen delivery options. So if you were to truck in the oxygen, with regard to the amount of diesel that you would spend per year, it's almost $20,000 compared to 0 if you had your site on, if you had the plant on site. Moving forward to emissions, almost 52,000 tons are emitted in that process as compared to 0 if you have the plant on site. And that just addresses CO2, which doesn't address the other greenhouse gases that are also emitted in that process. And finally, there's another financial implication that has to do with the carbon credits that Akon touched on before. And to offset the emissions that are happening in that process, it's upwards of $4,500. And so now to take like a wider lens, next slide, Jeffrey, please. And to expand on what that means, there are 3 sort of verticals that also differentiate the 2 types of options. With regard to the environmental changes, I touched on the CO2 emissions, but also methane, nitrous oxide, hydrocarbons, and volatile organic compounds are also emitted during this process, which has a negative effect. Additionally, there are safety hazards. Pressurized gas is extremely dangerous, in addition to the other sort of physical hazards that could come because of the strenuous activity. In addition, the costs that I talked about, which range to almost $25,000, also have associated costs with truck drivers and the other things that cost in the moving of the oxygen. As Dr. Boffey stated earlier, as that bill rises, there's a direct negative effect on healthcare because the dollars that are spent on diesel or the moving of the oxygen from outside plants to the hospital are dollars that are not able to be spent on healthcare. And I think that will lead us to our 3rd best practice, which Serena will touch on.
Essentially, what we've learned from this discussion, these presentations, is there are 3 best practices, right? Practice number 1, we need to plan as leaders for energy efficiency. We come back to the same point. Let's convert our diesel dollars to what? Healthcare dollars, please. Our best practice 2, we need to combine the most efficient way of, in our case, providing medical oxygen. And we do that with a VSA technology. We do that in combination with solar, battery, renewable solutions, and best practice 3, where did it go? Where did best practice 3 go? That's right. We want to aim for things that are on site. Oxygen and energy lose their value the farther they are from where they need to be. So point of care and point of dispersal is key. That's best practice number 3. All right, thank you.
All right. So, to put a conclusion on our workshop, I'm going to bring up Honorable Dr. Wilhelmina Jala, who is Minister of Health for Liberia. Dr. Jala, the floor is yours.
Good afternoon to all. You have to do better than that. Good afternoon to all. Now, thank you very much. I'm Dr. Wilhelmina Jala, the Minister of Health from Liberia. Now, if we were speaking about COVID-19, I'm sure this room was going to be filled. And I can tell you as a witness, during the Delta variant, we lost a lot of people because we did not have medical grade oxygen that we needed to save a lot of lives. But at the end of the COVID-19, when I was asked, what do you want as the Minister of Health? I said I wanted oxygen plant. But since I was not well educated and I didn't have good advisors, we did purchase about 10 oxygen plants. All of them were PSA plants without solar. So a lot of them have to rely on diesel for powering up or the grid, which we see is very expensive. But I am so glad that I met up with the African Infrastructure Relief Support Project. They were able to introduce to me this new technology of the VSA plant. So even though the 10 plants went to other counties, and I was asked, where should we put this particular plant? I decided that we put it in the southeast of Liberia, where the rural people deserve the same kind of health care that the urban people deserve. So this facility, this plant is going to an 86-bed referral hospital in the hard-to-reach area that takes care of other 5 counties. They take care of people from Grand Bassa, Grand Jida, and all the other counties around Sino County. So can you imagine when we get this plant up and running, the kind of diesel dollar that will turn into healthcare dollars? The budget is not already big to take care of that county. So I'm sure at that rate, we'll be able to make sure that we are part of the elimination of cervical cancer. We'll be able to see our maternal mortality rate go down in that area. We'll see our neonatal mortality rate go down in that area because we will have a plant that will pipe the oxygen directly into the facility. But to top it off, we'll also have a whole solar farm that will not only power the oxygen into the hospital, but will also provide 24-hour current for the hospital. And as we save on the energy that will be generated, we might be able to supply even the houses that is around the facility. So this is great news for us. When I heard it, as in your position while you were clicking, I was clicking on the right buttons. So I can smile and say that I, as a government official, made the right choice for the people that live in that county in Liberia. So I would like to thank all of the supporters that they showed on the screen, but most especially the IGPC, the SCCM, Direct Relief, and Johns Hopkins University. Now, to close, I would like to say that to close, we are very, very proud. Liberia is proud. Sino County is proud. We are proud to have a complete renewable package with the plant, the solar piped in, and it comes with training, because you can't have this beautiful system and your biotech technicians are not trained. It comes with training for us to take ownership of this particular plant. And I would like to appeal to all of you to make sure that you have good interest. When somebody comes to you and say we want to do health system strengthening, make sure that the health system strengthening portion includes renewable energy, because health has a role to play. I know we have been on the sideline for a long time, but we need to be sitting at the table to be able to make some of these decisions. We all know that Africa emits less chemical into the air, but we are going to be the ones suffering. So some of the decisions we have to make have to be correct decisions where we can smile and save diesel dollars to healthcare dollars and make not only Liberia, not only Africa, but the world a safe place for all of us to survive. Thank you.
That was beautiful. Minister of Health, Liberia.
Yes, thank you so much, Minister Jala. Thank you. That's wonderful, wonderful testimony. And this is someone who is living the project, and we'll see the results of the great work that this team is doing. So I'd like to thank you for joining us here today, and hope you get a chance to see, or you've now seen. Did I skip ahead here? No.
We have 5 minutes.
Yeah, okay. So we would like to thank you for coming. We hope you get a chance to see that the impact that our AIRS project is making, that it really is changing lives, saving lives. And as someone who is going to echo the comments of Minister Jala, we would welcome the opportunity to speak with anyone who is interested in becoming one of our project partners, a connector, or a funder of any of our projects. We are actively looking for new projects. We would love to talk to you, so please come up to me or anyone else on the stage here and ask us any questions you like. So again, thank you very much. I think we've got time for just a few questions.
I can take questions at this mic, please.
Good morning, ladies. Good morning, good evening. Good evening. So as a leader of my great nation, and I'm looking at what you're talking about, cutting costs, I need a little bit of clarification. So when you bring this amazing technology on the ground, what about maintenance? Have we looked at, are we going to be saying we are saving dollars, saving diesel dollars, but at the end of the day, the maintenance cost is higher than how much it would cost to just operate the way we were? Also, are you going to offer technical training on ground on how to use this machine, so that then we don't have them on ground and then we don't understand how to use them, so they then become like a flower we all just look at? Thank you.
Thank you. In addition to a robust maintenance package that is implemented by our Ghanaian partner, so a Ghanaian partner having an African partner that will have the relationship with the biomedical technicians in Ghana, Gambia, and Sierra Leone. We also are working with a biomedical training program to actually create a new biomedical training system specifically for vacuum swing absorption technology that will actually certify the technicians in competencies related to maintaining that. So while in addition to certifying them, we're going to also be training them to be trainers to train other people in how to maintain this type of equipment. And with the iterative process, in other words, they get trained again, then they do the training while we watch them, and then they train totally. So that's what our process is for oxygen. We have a similar process for solar. So for this program, we're actually using an international solar company, training company out of Colorado that does both online training and in-person training. And each of the biomedical technicians being trained has an iPad loaded with data so that they can even do the online training while they're at home. After they pass that, then they will have an in-person, hands-on training on managing solar facilities that are connected to a grid, as well as solar systems connected to a battery. So we're really putting a lot of effort so that we can do this type of training programs, and hopefully those people will also be resources to other facilities, to other places in Liberia that have oxygen generating plants, or other places in the area that may have solar that need to be maintained as well.
I think we're out of time.
Okay, good. Well, thank you so much for coming, and enjoy the rest of your conference.
Thank you, leaders. We just need to get our clickers. Have a wonderful rest.